Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an educational grant from Moderna Therapeutics.
Hello and welcome. I'm Dr. Greg Poland, Professor of Medicine and Infectious Diseases at the Mayo Clinic and the Director and Founder of the Mayo Vaccine Research Group and Editor-in-Chief of Vaccine. I'm joined today by my good friend and colleague, Dr. Bill Schaffner, who's also Professor of Preventive Medicine and Infectious Diseases at Vanderbilt University Medical Center in Nashville, Tennessee. Today, we're going to do the first installment of a six-part series of podcasts on the evolving landscape around COVID-19 vaccines. And today, we're going to talk about key evidence updates on COVID-19 vaccines. So welcome, Bill.
Good to be with you, Greg. This is an important topic, and it's one that's a one in constant change, isn't it?
Indeed. We're a bit flying the airplane as we build it, but that's the nature of a pandemic. So let's just start off with talking about what are some of the latest developments in the COVID-19 vaccine landscape.
Well, the first is that we are really in lickety-split fashion vaccinating people. More than a third of the population have received at least, adult population, have received at least one dose of the vaccine. And the daily tally of vaccinations really is doing very well. Somewhere between 3 and 4 million doses are being administered on a daily basis. The safety record of these vaccines continues to be very good, and we have to put a little bit of an asterisk next to that, because we all know that at the moment, the J&J Janssen vaccine, which is the adenovirus vector vaccine, is on pause. We're not using it because there's been a safety issue raised of a very rare blood clotting issue with thrombocytopenia among women under the age of 50. So the CDC's Advisory Committee on Immunization Practices is looking into that. But other than that, the safety issues associated with these vaccines have been very, very good. There are 3 vaccines that are currently approved for use under an emergency use authorization by the Food and Drug Administration. 2 mRNA vaccines, one by Pfizer and one by Moderna. And then there's the adenovirus vector vaccine available from Johnson & Johnson. It should be mentioned, we have an extraordinarily comprehensive and effective safety surveillance system out there across the country. There are many attributes to it, aspects of it. The most prominent among them is VAERS, the Vaccine Adverse Events Reporting System, run by the CDC in cooperation with the Food and Drug Administration. Any physician or indeed any patient can make a report. Just go into Google, put in VAERS, you'll get the reporting form, and you can report in. These reports are looked at almost instantaneously, and if there's ever a signal of a possible adverse event, it's being investigated very intensively and very, very quickly. It's the best safety evaluation system for any vaccine in the world, and it's the best we've ever had in the United States.
So, Bill, we touched upon rare adverse events. Let's talk a little bit about that in relation to the J&J vaccine and whether other rare events have shown up with the 2 mRNA vaccines.
Yeah, Greg, the J&J vaccine issue is currently in the news. It is indeed very, very rare. In about 1 for every million doses administered of the J&J vaccine, there is a severe blood clotting thrombocytopenia issue that can involve the cerebral venous sinuses as well as the splanchnic veins in the abdomen. And these occur in combination with thrombocytopenia, a very unusual syndrome. Therefore, the CDC and FDA have currently put the use of the J&J vaccine on hold while they investigate it further. These cases have occurred in women aged between 18 and 48, and the symptoms have occurred 6 to 13 days after vaccination. So it seems like a very confined risk window. There are some striking similarities with the similar issues that have occurred with the AstraZeneca vaccines, which are being used in Europe and other parts of the world. They're both adenovirus vector vaccines, and so one really wonders whether these vaccines are predisposing to these very, very rare events. They have not occurred, I would say, after either the Pfizer or Moderna vaccines, which have been used in this country in much larger numbers than has the J&J vaccine.
And Bill, what about other rare adverse events with, say, the mRNA vaccines?
Well, the mRNA vaccines, as we know, have been associated with anaphylaxis. These events occur almost completely in people who previously have had serious anaphylactic reactions. These are the folks who carry EpiPens, and any of these people may receive, often in consultation with their physicians, they can receive an mRNA vaccine. What we would do is ask them to let everybody know about that at the vaccination site. They will be observed for an additional period of time, a full 30 minutes after the event. And we certainly have been urging our folks who are in that group, that very small group, to get their vaccination close to a medical facility that can deal with that kind of an emergency should it occur.
Yeah, that's great. We do the exact same thing. Bill, what about our patients who have already been vaccinated with J&J vaccine? Is there a reason for them to be concerned?
I think it's important that they be alerted to this very rare event. About half the J&J vaccine has been given within the previous 2 weeks. That's within the risk interval. And we urge those people, if they have a severe headache, abdominal pain, pain in their legs, or any difficulty breathing, please contact their medical provider and by all means, let them know that they've received the J&J vaccine and when they did receive it.
Agree. Well, I'm going to switch tracks a little bit, Bill, and by definition, we don't know the full answer to this question yet, but all of us are interested in what we know at this point about the durability of the immune response induced by these vaccines.
Don't we all want to know that, Greg? So COVID-19 is a new disease. The vaccines are new vaccines, and therefore the durability of the immune protection that we receive, either from the infection or from the vaccines, is really still unknown. And the correlates of protection are also still unknown. So the antibody titers that correlate with vaccine protection still are under investigation. However, we do know that so far studies with the Moderna vaccines that antibodies have persisted through 6 months after the second dose. And as we're speaking, we're still counting. So far, so good. Stay tuned.
Exactly. Okay. One of the most frequent questions I get, and I'm sure you do too, is do these vaccines suppress viral load or prevent transmission?
Viral load is associated with COVID-19 symptomatic disease. The higher the viral load, the more likely you are to be symptomatic. And The vaccines clearly in the clinical trials have been shown to protect against severe disease, hospitalization, and death. However, this notion about whether they can protect against infection and remain asymptomatic or only mildly symptomatic, and could you still be a transmitter, is still somewhat up in the air. However, I will say that data have been accumulating, particularly from a recent Israeli study showing that the Pfizer vaccine resulted in reduced viral load for infections 12 to 37 days after the first dose of the vaccine. So I think we're getting more confident that there is a substantial reduction in the risk of asymptomatic infection and transmission by vaccine recipients.
I agree, and I read the data the same way. So, do we have any data available for patient populations that were not represented in the phase 3 clinical trials?
Well, there are any number of populations, including very frail people in nursing homes, and of course, people who are immunocompromised, and we're vaccinating those people at the present time. I think the best data we have about nursing homes is we will all recall that they were in the first line of groups to be vaccinated, and they've been vaccinated, that is, the residents of nursing homes have been vaccinated rather comprehensively. And you will notice that nursing home outbreaks have virtually disappeared since we've done that. So that's very encouraging. Now, of course, we're just starting now to study the use of these vaccines in adolescents and younger children. We need to vaccinate them, first of all, for their own protection. Yes, it's clear that they are much less likely to become severely ill, but they still can become severely ill on occasion, and they can also be transmitters. So we would like to vaccinate them. And those studies are underway. Children under 16, not currently eligible, but Pfizer's conducting trials in adolescents, 12 to 15 years of age, and then down the ladder of age, 6 months to 11 years old. And Moderna is also in the game. We like that. They're studying those age groups also.
Yeah, good points. In fact, Pfizer's actually submitted a request for an EUA for that 12 to 15-year-old age group. So we've had vaccines available now for some months. What's the uptake of the vaccine been like in your view, Bill?
Both good, and then there's the other side of the coin, because the eager beavers, the early acceptors, have been out rolling up their sleeves. We've been vaccinating people age 65 and older and working our way down the adult age range. It's now available to everyone here in our neck of the woods and most of the country for all adults age 16 and older. As we get into the younger age groups, however, you run into more reluctance and hesitance. You run into a degree of indifference. People have heard that the younger you are, the less likely you are to become ill, and so they don't see the immediate personal reason to get vaccinated. And then I must tell you, at least in my neck of the woods, as we get more rural, there's more reluctance and even a certain indifference to vaccination. So as we ramp up and try to vaccinate more and more people, we're going to have to do more to be persuasive, comforting, reassuring, bringing people in as we notch up. And for every increment of people we want to vaccinate, we're going to have to work harder to do it.
Bill, that was great. Thank you for participating today. I think in conclusion, what we want to say is that the vaccine landscape is evolving rapidly. New data are accumulating and new concepts evolving. We have 3 vaccines in the U.S. that are under EUA status. However, one, the Johnson & Johnson or Janssen vaccine, has been paused temporarily as further investigations accrue around this rare syndrome of arterial and venous thrombosis associated with thrombocytopenia. It's quite clear that the vaccination initiative will expand to include children in the near future, and as mentioned, an EUA application has already come forward. There are, however, still some unanswered questions. Correlates of protection among them, viral load, durability of immune response, and what the effect of viral variants might be. So I think what Bill and I would both agree on is that this has certainly been the largest vaccine initiative in our history, and very good vaccines have become available in record time. The next challenge is going to be that of continuing to roll out the vaccines. So with that, Bill, any other parting words, and we'll end.
When in doubt, vaccinate. We are still trying to get every adult in the United States protected by vaccines against COVID-19. We hope that all of our colleagues will continue to recommend vaccination to all their patients.
I agree. It's amazing to realize 1 in 10 Americans has been infected with this virus. 1 out of every 570 Americans has died as a result of this virus. 40,000 children have lost a parent due to COVID, and almost 1 in 10 children who have developed COVID have ended up hospitalized. All of this we expect could be worse, particularly among unimmunized people with these evolving variants. So stay tuned, and we thank you for participating in this activity.